Anxiety disorders or mental health issues. Look at this picture, shows that fear, feeling of worry, nervousness. Look at this detail going on. Anxiety disorders are a group of mental health conditions characterized by excessive fear, worry, or nervousness. These feelings can interfere with daily life and are often disproportionate to the actual situation. Anxiety disorders are among the most common mental health issue worldwide, impacting individuals' social, occupational, and personal lives. A definition: anxiety disorders are defined as mental health conditions marked by significant and persistent fear or worry, often accompanied by physical symptoms. These disorders differ from normal anxiety by their intensity, duration, and interference with functioning. Types: 1. Generalized anxiety disorder, persistent excessive worry about various aspects of life. 2. Social anxiety disorder, intense fear of social situation due to concerns of embarrassment or judgment. 3. Specific phobias, irritable fear of specific objects, situations, or activities. 4. Acrophobia, fear of places or situations where escape may be difficult. 5. Separation anxiety disorder, excessive fear of being separated from attachment figures. 6. Selective mutation, inability to speak in certain social situations despite being able to speak in others. 7. Panic disorder, requiring unexpected panic attacks with intense fear and physical symptoms. Causes: 1. Biological factors. A. Neurotransmitter imbalances, example serotonin, dopamine, GABA. B. Hyperactivity in brain areas like the amygdala. C. Genetic predisposition, family history of anxiety disorder. 2. Environmental factors including A. Trauma or abuse, B. Chronic stress or adverse life events, C. Personality factors, traits like shyness or neuroticism, D. Medical conditions thyroid problems, heart arrhythmias, or chronic illness. Risk factors: 1. Family history of anxiety disorder. 2. Exposure to stressful or traumatic events. 3. Chronic illness or pain. 4. Substance abuse or withdrawal. 5. Personality traits like high sensitivity to stress. Complications: 1. Decreased quality of life. 2. Impaired relationship and social isolation. 3. Poor academic or occupational preference. 4. Increased risk of substance abuse. 5. Development of other mental health disorders like depression. Pathophysiology: dysregulation of the hypothalamic pituitary adrenal HPA axis leading to increased cortisol levels. Overactivation of the amygdala and underactivation of the prefrontal cortex. Balance of neurotransmitters like serotonin, norepinephrine, and GABA. Altered neural circuitry involved in threat detection and response. Pathophysiology of anxiety disorders, step-by-step process. 1. Triggering the stress response. 2. Amygdala activation. 3. Hypothalamic pituitary adrenal HPA axis dysregulation. The amygdala signals the hypothalamus to activate the HPA axis. A. The hypothalamus releases corticotrophin releasing hormone CRH. B. CRH stimulates the pituitary gland to release adrenocorticotropic hormone ACTH. C. ACTH signal the adrenal glands to release cortisol, the primary stress hormone. In anxiety disorders, cortisol levels may remain elevated, causing prolonged stress responses. D. Autonomic nervous system ANS hyperactivity. 5. Prefrontal cortex impairment. 6. Neurotransmitter imbalances. Gamma amino pitric acid GABA. It is an inhibitory neurotransmitter that calms the nervous system. Decreased GABA activity leads to heightened neuronal excitability and anxiety symptoms. Serotonin 5-HT. Low serotonin levels disrupt emotional regulation and contribute to anxiety. Norepinephrine NE increased norepinephrine activity enhances the stress response, causing hypervigilance and physical symptoms. Dopamine DA. Dysregulated dopamine pathways may impair reward and motivation, worsening anxiety. 7. Dysregulation of neural circuits. 8. Chronic stress and neuroplasticity. 9. Feedback loop dysfunction. 10. Chronic physical symptoms. Sustained ANS hyperactivity lead to persistent physical symptoms. Elevated blood pressure and heart rate. Gastrointestinal disturbances, example nausea, diarrhea, sleep disturbances due to hyperarousal. Signs and symptoms. 1. Emotional symptoms. A. Excessive fear, worry or nervousness. B. Difficulty concentrating. C. Feeling of impending doom. 2. Physical symptoms. A. Increased heart rate, tachycardia. B. Shortness of breath, dyspnea. C. Sweating. D. Tremors or shocking. E. Gastrointestinal issues like nausea or diarrhea. F. Fatigue or restlessness. Diagnosis. 1. Clinical assessment. Detailed history of symptoms. Impact on daily life. 2. Screening tools. Generalized anxiety disorder 7. Hamilton Anxiety Rate Scale. 3. Exclusion of medical cases. Thyroid function test, complete blood count CBC and other lab investigations to rule out underlying medical conditions. Nursing diagnosis. 1. Anxiety related to situational crisis as evidenced by restlessness and increased heart rate. 2. Ineffective coping related to inadequate stress management skills. 3. Sleep pattern disturbance related to excessive worry. 4. Social isolation related to fear of embarrassment in social situations. Management. First, medical management. A. Pharmacological treatment. 1. Selective serotonin reuptake inhibitors. Sertraline, fluoxetine. 2. Serotonin norepinephrine reuptake inhibitors. Venlafaxine. 3. Benzodiazepines lorazepam, alprazolam, short-term use. For beta blockers, propranolol for performance anxiety. 5. Tricyclic antidepressants, imipramine. 6. Busprone for GAD. B. Psychotherapy. 1. Cognitive behavioral therapy, focus on changing negative thought patterns. 2. Exposure therapy, gradual exposure to feared stimuli. Nursing management. 1. Assessment. A. Monitor vital signs for physical symptoms of anxiety. B. Assesses the patient's level of anxiety and coping mechanisms. 2. Interventions. A. Establish a therapeutic relationship with active listening. B. Teaching relaxation techniques, example deep breathing, progressive muscle relaxation. C. Provide a calm and safe environment. D. Encourage participation in therapy sessions. 3. Education. A. Inform about the condition and treatment options. B. Teach stress management and coping strategies. C. Advise adherence to medications and follow-up. Treatment. 1. Psychotherapy. A. Cognitive behavioral therapy, CBT. B. Exposure therapy. C. Acceptance and commitment therapy, ACT. D. Directional behavioral therapy, DBT. E. Supportive counseling and group therapy. 2. Pharmacological treatment. A. Antidepressants, selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, SNRI. Tricyclic antidepressants. B. Benzodiazepines. C. Buspirone. D. Beta blockers. E. Atypical antipsychotics. F. Antihistamines. Psychosocial medicine. 1. Support groups for individuals with anxiety. 2. Family counseling to educate and involve family members. 3. Social skill training for individuals with social anxiety disorder. Prevention. 1. Encourage regular physical activity and a balanced diet. 2. Teach stress management and mindfulness practices. 3. Limit caffeine and alcohol consumption. 4. Promote healthy sleep hygiene. 5. Early intervention for stressful or traumatic experiences. In conclusion, anxiety disorders are treatable conditions that significantly impact individuals' lives if left unaddressed. Early recognition, appropriate medical and psychological interventions, supporting individuals through education, empathy, and effective management strategies. Thank you. Have a nice day.